Here's my wife, Amy, and it's her first time getting behind the camera. So she's a little camera shy, which is to be expected.
Okay.
Maybe we could talk about Toad kind of ease and about how he hasn't been able to sleep on the bed because during top surgery you can't have dogs in the bed, huh? Do you want to explain that?
Because you know, you've got oozing and such, and you have some germs on them, and it can cause infection and such.
So that's been hard on all of us, him not sleeping in the bed.
Yeah.
I'll watch that part and see how you did.
Okay. Oh, you did a good job.
I think you look really, really pretty for... We're kind of, yeah, we're recovering from such the traumatic breast getting cut off, or whatever you want to say it, that we're not, looking great, but that's fine, because we want to portray an accurate situation, how it happened.
So, no makeup, pajamas. We haven't been sleeping very much because, it's hard. And especially with the little panic attack that he had last night. It was difficult for me too because I haven't been getting sleep and just a lot of emotions and stress involved.
Like worrying about me?
Yeah. Worrying I wasn't going to get any sleep.
It was waking you up and then needing help out with my chair and stuff.
Yeah. Oh yeah.
Do you want to talk about it?
Okay. So they called us like an hour early and they were ready for us. So we went in and they just Dr. Nygaard drew the outline.
First she was very, didn't she like, I remember she was very, very polite about like, I bet you're pretty nervous, are you? And then she was really able to build rapport with you.
Yeah, that's a whole nother video with
Yeah.
her, which we'll talk about that. But the day of, so we got comfortable and got the outline drawn on his chest of what's going to be removed and where the nipples were going to be placed and such. And then got his IV hooked up.
Which that didn't hurt that bad. If any of you guys are stressed out about that, that's not a part that you should be stressed about. Getting your blood drawn hurts worse than that. And then once I got that taken care of, they brought me into the operating room. I kissed Amy goodbye, and then they sat me down in this operating bed, and they put this warm blanket over me, and then everything just got all nice, and then I was just out. And I don't know what happened, but I was under for like 6 hours, which is a longer operation than normal, because that was, I guess you can talk about that, but I wanted to just stress that it felt like 5 minutes for me.
So I went and kept myself busy. They told me about 4.5 to 5 hour operation. And so, I was prepared. I brought some movies with my computer and such. And so, but I went and was around the town, kind of looked around and such. But then, when I came back to watch my movies, then they were like, oh, it should be about 45 minutes. So, about 15-minute mark, I kind of start packing up and such. And then the nurse, helper, assistant come out, and they're like, well, I guess it's going to be a little bit longer. Which it ended up being like almost an hour and a half to 2 hours longer, which that kind of annoyed me just a little bit because, then waiting is never too easy. I mean, I was confident that he was going to be just fine, but just that waiting. which they warned me, if you sit in the lobby and wait, it's going to feel like forever. So I shouldn't have packed up just quite that soon. But anyway, it did go longer than expected. And, well, the reason for that is because Dr. Nygaard does her surgery different than a lot of what we've seen on YouTube.
And what we've heard from other trans guys.
So she actually doesn't use drains, which he is second day, no drains.
No drains.
The reason for that is
It's nice.
she goes in and she takes that extra time and zaps those oozing spots. She told me that that he's on a table and it goes up and then it goes down and up, so that, you know, when you're up, gravity is pulling you down, so that she can just see what's it gonna look like. So she said she does that like a lot, like 10 times or more, and by doing that, you know, well, that and just waiting to see where the oozing spots are, then she's able to zap it. So she takes longer time to prevent the drains. She just doesn't do drains. And she is like, she called herself the boob doctor.
She has 20 years experience,
yeah,
with all different types of breast operations.
Mm-hmm. So like when she does breast reductions in females, she doesn't use drains in that either. Just because of taking that extra time to zap those oozing spots, because she feels like the drains can be a place for bacteria to get in and get infection, because it's like going, I mean, some of you know,
I heard
it goes
it's painful
into
too.
You know, your body, and yeah, and it is a lot more painful. So she doesn't use those, and there has been a little bit of oozing on the right side, because that was the side that took the longer time, which is why the operation took longer, because it oozed more than usual. But she said, you know, some people just do. Some people do that. So that's why it took a little longer, because he was under for so long, it took him longer than to wake up, which was hilarious.
So what?
Which was hilarious.
Yeah, when I woke up, I was definitely drugged up, and I remember feeling so lovey-dovey. I felt like I could finally express how I felt towards everybody, and that was just love. And I was like, I could finally tell you how I feel. Not just Amy, I was declaring Amy my divine love for Amy. But then Dr. Nygaard, I kept telling her thank you in like a really passionate way. Not like, it was nothing like lustful, not that kind of like lovey-dovey. It was like,
really appreciative.
it was this feeling of like, I don't know how to explain it, like loving humanity, or just, you know, just like it's sincerity love. It's just, oh my gosh, you know, you did this for me, and thank you so much. And then the anesthesiologist, I was like, what did I say? I said, oh, you're the really nice one. And I just told her how I felt about her, and I really do feel that way about her. And I felt uninhibited and definitely drugged up. What was your perspective? That's what it was like for me.
Yeah, so what I felt inside really wasn't portrayed. Well, at least that's what Seth said. So on the outside, it was funny. I was laughing a lot. Well, we all kind of were. And I was thinking, oh, I hope he doesn't say anything embarrassing, because, I mean, he was like really being honest, like just of how much he loved me and them, you know, and just how thankful he was, and so I was like, I wonder how far this is gonna go. But I mean, I was like, I didn't really care if he did say anything. I mean, there's not a whole lot, but
That would be kind of intense.
it would have just probably been funny. Dr. Nygaard was telling me how he probably is not going to remember a whole lot of it.
Which I remembered most of it.
Yeah,
She kept saying that. I'm like, No, I'm fully here, and I know exactly what I'm saying, and I mean all of it.
Yeah. Which is cute. But
I
so
was nauseated and I could barely walk, though.
yeah. So we'll be an under for that long. I mean, it's understandable. But inside, when I saw him, and he wasn't his usual self, I kind of was like scared. I was just like, oh, how am I going to handle this? And what if he falls? And I mean, he's bigger than me, and I'm not that strong. And then just kind of had to really sort of push those thoughts away, because I mean,
Gotta
you
be a
have to deal
caregiver.
with it. I mean, you just deal with it. And so they helped a lot move him. They kind of gave me suggestions, putting my hands on his hips. Like if I'm helping him out of bed, use the shoulders. You don't want to grab anywhere, and you don't want to offer an arm, because pulling up, that's using your pec muscles and such. So, they gave me pointers and such, and then on the drive home, that was a little intense too, because I had to
Can I say something
yeah,
first?
yeah.
I wanted to just, how I felt like Nygaard had really good bedside manners, and the anesthesiologist, how they just handled me. Like I had nausea, and they put a suppository up my butt, which, well, we're just being completely honest in this video. I don't know, I didn't, maybe it was because I was so drugged up, I didn't feel awkward, but, she even rubbed my back when I was having a hard time waking up, and just really just a sweet surgeon, and I can't imagine going through this whole procedure with somebody who's just impersonal, and who I did. Well, I can't imagine going through this procedure with somebody who I couldn't have been that vulnerable with. I mean, like, you're laying your chest out there for somebody to go and operate on, and that's pretty vulnerable. Go ahead and talk about on the drive home.
Oh yeah. So we finally got him in the car, and then real quick with the suppositories up his ass. That was to help with nausea, because it gets through in what is that word? It gets into your blood better, or your body. Um, anyway, they also gave him the pill that dissolved underneath your tongue, to help with nausea, um, and then some alcohol swabs to kind of fan in your face. We used some of those. But anyway, so on the ride home, um, it was dark. I mean, we didn't leave until like 10 at night. And we got there
I don't even remember the ride home.
11 in the morning. Something like that. Anyway, it was a really long day. So it was difficult on the ride home. I mean, I was alone then. I didn't have the nurse, or the anesthesiologist, and I didn't have Dr. Nygaard there. I was alone. So I was like, okay, well, I mean, we had baggies in case he threw up, and he slept, which helped me a lot.
I feel like if I would have woke up, I would have thrown up, so I knew I had to stay asleep.
Yeah. Which, when we did get home and we stopped the car, he did throw up. So
I threw up twice, yeah.
yeah.
It was like throwing up water, though. It really wasn't, the throw up wasn't that painful.
Yeah. So the car ride home, I mean, it was just having to deal with a lot of anxiety in myself, my thoughts, being like nervous, I mean, they were really stupid thoughts, and stuff like, getting in car wrecks, or just stuff, but really, I feel like it really was just because of all the anxiety of everything that just happened, and such a big day, and waiting for even extra longer than normal, and I mean, it was just a lot of stress, a lot of emotions. So when we finally got home, it took him a little while to get out of the car, and we have like 6 steps to walk up, and he was still, really drugged up and really sleepy, so it was very important that I made sure, Seth, are your eyes open? Are you awake? And just really kind of loud. And I had my hands on his hips when we walked up the stairs. And then we got him in the house. Did you throw up again in the house? Yeah, you did.
I did.
Yeah, you wanted another pain med because you wanted to keep up on that.
Yeah.
And then I kind of didn't have a good feeling about the one, but I mean, the one that you threw up on, it causes a little bit of sickness and nausea too. The pain meds, especially if you don't take it with any food, without any food. And he had only had like a couple saltine crackers, and then some water. So that's what caused all that, you know, just getting out of surgery and such. Coming off of anesthesia makes a person really...
Yeah, that anesthesia, man.
So we had a lot of anxiety, so that then that night, well, I didn't get a whole lot of sleep. Well, you didn't really get a lot of sleep either.
Yeah, I woke up every hour or two. I forgot why. Maybe just to make sure I was on top of the pain meds.
Yeah. He didn't take him every hour or two, though. I mean, it wasn't like...
Yeah, or maybe just to go to the bathroom or just drink water. Probably just such a new, like, experience. It's overwhelming. I guess I hear a lot of guys just sleeping the whole time. I slept for 6 hours during my surgery, you know. So I probably slept 6 hours that night or so, maybe 8, but not that much.
No,
Huh?
I don't think so. Because we woke up like at 4 in the morning and talked a little bit, and then I woke up pretty much any time he moved because I was worried that his arms were going to go up. He's not allowed to go up and like adjust his pillow or, I don't know, sleep in odd positions and such. You know, it has to be on the back, so.
And my hands had fallen asleep too. These 3 fingers, the thumb, the index, and then the middle finger on each side were numb. But this finger has gotten sensation back, and this one is still numb. She says it's from being stretched out. So.
Yeah, because in the table he was kind of in this sort of position, you know, for that long. Yeah, it's definitely gonna make your... I mean, if you're in any position for that long, something is bound to go to sleep. So, yeah, his arms or his fingers are what got it.
Yeah.
Which they said is normal. They said that's...
I'm feeling a lot better today. Being on top of the pain meds. Can't stress that. A good caregiver.
Mm-hmm.
It's important.
Yes, he gave me some sleep, so I'm happy now. Mm-hmm.